live on UGTV in about 30 seconds.
Are we ready to roll?
Yes, we are.
Very good. So before I call the meeting to order, I want to announce that due to COVID-19, we have individuals attending by way of conference call. All participants joining by phone should mute their phones when not speaking to avoid background noise. During the meeting, please make sure that you announce yourself by name and title every time you speak so that the public participating knows who is speaking. This is critical given the number of remote participants and his current guidance from Kansas Attorney General. We'll now call the meeting to order. Thank everyone for being here tonight. I'd ask the clerk to announce the meeting and call the roll.
A special session is being held on Thursday, April 30th, 2020 at 5:00 p.m. for an update regarding COVID-19 activities, followed by future fire station locations. Roll call. Markley.
Here.
Walters.
Here.
Gilbert.
Here.
Bynum.
Here.
Burrows.
Here.
Townsend. McKiernan.
Here.
Ramirez.
Here.
Johnson.
Here.
Kane.
Here.
Townsend. Alvey.
Here. Thank you. All right, tonight we are having updates for COVID-19 and fire stations. I'll turn it over to Administrator Bach.
Thank you, Mayor. We've had a lot going on over the last week since the last time we appeared before the commission and had any update in regard to this. Today's a particularly big day, I guess, as we are looking forward to the announcement of the governor this evening, and all indications are that the state of Kansas will not be extending their date beyond the current May 3rd. So with that, we are now in a position to look to what we are going to do for extension of our own stay-at-home order and guidelines that we'll be under on this. So tonight, the health department is going to give us an update of where we are and then present where we're going in that direction. So with that, I will turn this over to the health department. I see Julianne in the screen. Are we recognizing you all there in the department to start this, or do we have a different start?
Hello, Terry, are you on? Terry's not with us here in the health department.
Terry just got on. She should be on here in just a second.
Okay, then we are ready. This is Julianne Van Loo. I'm in the health department with Dr. Alan Greiner and Dr. Aaron Corvo. Terry's going to give us a start. Just to check, Elizabeth and Janelle, are you both on as well?
Yes, Elizabeth's on.
Okay.
Yes, Janelle's here as well.
Great. Terry, let me know when you're ready.
Okay. Can you hear me?
Yes, we can.
Okay, perfect. All right. Good evening, everyone, and welcome back to the Board of Health COVID-19 update for Thursday, April the 30th. We are here to give some further information regarding where we're at with the pandemic and what things we are doing and where we're going from here, at least the kind of the next steps in the next few weeks. It's kind of a week to week situation. It's very fluid, and we're working on it each day. So we'll go ahead with the situational update. The team has been working very hard on the stay-at-home orders and the phasing of the reopening. So that's been a work in progress, and I think we're ready to share some of that information. And then as well, we are also have developed, as this continues and different needs arise, we are working on providing you with a kind of some information, some tentative information of what those needs are looking like as we are moving forward through this. So that is kind of our agenda for tonight. And so first off, we're going to kind of give you an update of where we're at. So as you can see from the slide, Kansas has 3,700, and I'm sorry, my little thingy is off and I can't see my numbers. I have all these pictures. How do I move the pictures?
Can you drag the?
I got it. I'm sorry. So Kansas has 3,738 positive cases with 125 deaths. Johnson County, 462 with 40 deaths. Kansas City, Missouri, 520 with 15 deaths. And Wyandotte County stands at 674 positive cases with 55 mortalities. The important line is actually the rate. That is how we determine it. It really puts everyone in perspective in the same way, because that is the number of cases per 100,000 population. And when you actually look at the rate that is consistent across the board, you can tell that Wyandotte County is about 4 times any of the other areas, surrounding areas, Johnson County, Kansas City, Missouri, and the state of Kansas as a whole. Wyandotte County is about 4 times greater than what any of those entities are. So that says we have a lot of disease within our population. Testing, we're doing testing every day here at the health department. It's Monday through Friday, and it's 1 to 5. To date, we've done about 675 tests. That's not including what we've done today, obviously. And we've got about a 27% of the tests resulted, and or 27% of the resulted tests are positive. We also have pop-up sites pop-up testing sites within our community, and that is in coordination with Vibrant Health, which is a federally qualified health center in the county, as well as Swope Health, which is another federally qualified health center. And those pop-up testing sites, the Vibrant had one yesterday, and that's in coordination with our health team. And the one
I'm on a virtual commission meeting, so I can't see me.
Was at the Kansas City, Kansas Community College Tech Center. And then today, Vibrant had one at Salem Baptist Church. It's actually going on right now from 3 to 6 today. And Swope Health had one today from 11 to 3, I think it was. And that was at the Franklin Center on Metropolitan, about 14th and Metropolitan. So we are really ramping up our testing and getting quite a bit of testing out in the community now instead of in the hospital. So, but again, 27% of the tests that have been resulted at the health department are positive. So we're looking at about a 27% positivity rate.
Okay, so where can you find both the information on COVID stats as well as information on testing? We've launched a new hub just in the last couple of days. So if you're familiar with our WICO KCK COVID page, you'll notice that next to our dashboard, which we will continue maintaining, we also now have a button that says COVID Hub. And this includes all of the information that's on the dashboard, but a lot of additional information as well. So I'm not going to walk you through the whole site, but want to point out a couple of things. One of the things being that we now know how many people have been tested overall. So we're getting information on negative tests back from KDHE into our EpiTrack system. So we now can better track the percent who have tested positive, which we weren't able to do as of the last time we spoke. Another important area here is if you've got symptoms, you need to get tested. So if you go to that Explore page, you can see information on testing, and then you can also see all the pop-up testing site locations, and those will be updated regularly. We should know by tomorrow the sites for next week, so that will be updated as soon as we know for sure, and those are also mapped. Also on the hub page, a couple of other things we want to show you. A lot of this data is on the other dashboard, but some of it's not. So we're really focusing on adding the race and ethnicity data, especially by rates, to make it comparable to one another. As Terry mentioned, we're adding pre-existing condition data that we didn't have before on, cardiovascular disease, diabetes, lung disease, et cetera. We're still trying to collect additional information on that. And then one area that I think folks will be interested in is we now have an outbreak locations section. So you can see here that these are mapped. If you select in to one of these, you can see the address, what kind of facility it is, the number of cases, the number of deaths associated with it, and the last known reported case. So all clusters or outbreaks that have at least 5 associated cases with it will be put onto this side of the hub page and will be updated routinely. So I know we've gotten a lot of questions about that. There's one other section here to note. We're trying to do a little bit more metro area comparison. So a nice map that shows kind of the rates per geographic area, again, which Terry just mentioned, but in a geographical way here, you can really see, how our situation compares to the other communities. So we'd encourage you to check this out. If there are things that you wish were on here that aren't or that don't make sense to you, please let us know. We're every day working with our fantastic data team over in the knowledge department to keep getting better at that. So I will swing us back here to continue talking about how we're getting information out. Take it away, Janelle.
I guess it helps if I unmute myself. Okay. Hi, I'm Janelle Friesen. I'm the Public Information Officer for the Unified Government Public Health Department. So a few communications updates since the last time that we presented to you. As you probably saw, the Citizen Newsletter hit mailboxes, which was a special edition focused heavily on COVID-19. We also now have electronic versions of that in English and Spanish available. Additionally, we'd heard a lot last time, and through other input we got about concern about people who live near Riverbend, about wanting to know what's going on there, and we really took that to heart. So we did end up sending a letter from Dr. Greiner, our Chief Medical Officer, to residents within a half a mile of Riverbend to give them some updates and to talk to them in general with more information about COVID-19. We're focusing a lot on communications around testing right now. So we, especially our different testing locations. So we've mentioned our testing every week, Monday through Friday at the health department and those community pop-up locations. We've been doing communications via social media and other web communications. We have some flyers that we've sent to partners if they want to print those out. For the pop-up locations, a lot of those have come together very quickly so far, but moving forward, we're hoping to have some of those scheduled out further. The Health Equity Task Force that's determining where those are going to be, when they're going to be, they're working on that right now. And when we have those a little bit further out, we may be able to do things like sending postcards to people who live within a certain radius of those pop-up locations. So we're going to just have some ongoing communications in different forms about testing. Coming up, we're also going to focus pretty heavily on the Restart WICO, which we'll be talking more about later, but this idea of people wondering what happens with the stay-at-home order, and as we move toward going away from the stay-at-home order, gradually reopening things as it's safe, what's that going to look like? Sage Communications, who we've been working with, in addition to our great communications team we have, a little shout out to Dave Reno and Alan House internally, as well as, again, the Sage folks. They've come up with some great different ways that we can communicate over the next several months about that and what that looks like, because we know people are really wondering what that means for their businesses and just for themselves and their families. And I don't think that we have a lot more to cover with that right now. I think we'll touch a little bit more on communications when we talk about some of our health department needs later.
One other thing we wanted to kind of make note of that relates to communications but is broader is our overall attempt at community engagement. So I know a lot of you have heard of many of these things, but we've got our health equity task force up and running. The Restart WICO task force has been very successful in engaging businesses of all types in that discussion. We got over 400 responses from the community as relate to the survey that we put out for feedback about restarting. Every single day we do an 11 a.m. with community institutions. The mayor and others lead faith calls, business leader calls. I convene the safety net call every single week. There's now a long-term care facility advisory group that's meeting weekly. So just wanted to continue to put out a sense of the many, many ways we're trying to engage different sectors in our community as we work through this. And now to Elizabeth to talk a little bit about an update on our outbreaks and clusters.
Julianne, did you want to mention the child care group that's going to be starting on Monday?
Dr. Fee?
Sure.
We can't hear you, Dr.
Hear you, Dr. Corvo.
I'm sorry, guys. Thank you for letting me know that. We also have a child care and education working group.
You're still not able to hear you.
Okay, can you hear me now?
Yes.
Okay, I apologize. We are also having a child care and education work group that is going to be coming together for the first time on Monday. And that is in an effort to, I think, provide more solid guidance in the education and child care sector for the reopening of Wyandotte County. We've also contacted a few people in the legal community about sort of a medical legal guidance for workers going forward as we do our Restart WICO as well. Elizabeth, take it away.
Hello, I'm Elizabeth Gronweg. I'm the epidemiologist for the health department. So just to kind of start with, each and every lab confirmed case of COVID in Wyandotte County is investigated by our wonderful team of contact investigators, including volunteer KU medical students and UG staff. So each and every case is investigated to find out where they might have been exposed and what kind of other places they might have exposed other people to. And through this contact investigation process, we do identify clusters and outbreaks within Wyandotte County, and we follow up on these outbreaks and clusters to find out, are there other cases that we need to identify? What kind of control measures can we put into place to prevent it from spreading within the environment? And, just other things we can do to try to control these outbreaks as we identify them. So we've kind of grouped these outbreaks into different categories. The first is faith-based locations. So I think that everyone's aware of the Miracle Temple Eastern Kansas Ministers Conference that took place last month, and we identified 55 cases across the state of Kansas associated with this outbreak, and unfortunately 6 deaths that were associated with this outbreak. There was also a Rising Star Baptist Church gala that occurred last month where we identified 7 cases and 1 death. More recently, we identified that the House of Guadalupe convent in Wyandotte County, some of the nuns there and other individuals associated with that convent have tested positive. And that's a more recent outbreak, with the last reported case actually being reported today. And we've identified 5 cases so far associated with that outbreak. We've also identified 3 different outbreaks within long-term care facilities. I think everyone's aware of Riverbend Post-Acute Rehab and the outbreak that they've had going on. We've identified 132 cases among residents and staff, and unfortunately, there's also been 32 deaths among residents at Riverbend. In addition, Delaware Highlands Assisted Living, we've identified 18 cases associated with this facility among residents and staff. And we're working closely with that facility. Yesterday, they tested all of the residents and staff to see if there's any other cases that we're missing, and we've worked closely with them to put control measures into place. We've also identified an outbreak at Life Care Center of Kansas City. We've identified 13 cases and 2 deaths associated with this facility, and they will be testing all residents and staff tomorrow. We've also worked closely and have gotten guidance from actually an expert from the CDC that was visiting Kansas, as well as our long-term care task force has worked closely with Life Care Center to put control measures into place and provide guidance for this outbreak. And then the last group of clusters that we've identified is at workplaces here in Wyandotte County. Unfortunately, it seems that for whatever reason, these factories and processing plants and things like that are turning out to be a hotspot for COVID. I'm sure you've seen in the news across the state of Kansas and Missouri, a lot of these type of facilities are experiencing COVID outbreaks. We've identified 4 here in Wyandotte County workplace outbreaks. The Kellogg's Bakery in Kansas City, Kansas has had 19 cases so far. There was a Donnelly construction site where they identified 8 cases of COVID. The National Beef Packaging, also known as Casey Steak Company, has identified 23 cases among employees. Premier Custom Foods has identified 10 cases among employees. Not included on this slide because it's still an outbreak that we're working and have identified more cases just today as El Torito Supermarket in Kansas City, Kansas. We've had, I believe, 6 employees so far test positive at El Torito Supermarket as well. And we are every single day investigating more workplaces and uncovering new outbreaks. So this is just the ones that we've identified, 5 or more cases so far as of today.
Thank you, Elizabeth.
Hi, everybody. This is Erin Corvo, again, the Deputy Health Officer here. In previous meetings, we had talked briefly about asymptomatic testing of residents in Wyandotte County. We have been talking about and preparing for getting sort of a representative sample of Wyandotte County in order to ask if residents would like to be tested. However, we've put that on hold for a bit here with the resources that we have. Currently, we're still trying to test all of the people who are symptomatic in the community and their close contacts. But we do have a new priority for asymptomatic testing that we've identified, and that is at this time long-term care facilities. So if there are outbreaks or residents there who are testing positive, for a couple of the long-term care facilities now, we've been able to go in and test all of the residents and workers, and we're still awaiting results of a couple of those facility testings. We're also looking into testing some asymptomatic workers in these workplace clusters, as Elizabeth just mentioned, and hopefully we'll one day have enough tests and resources to be able to do that representative sample of Wyandotte County. Our goal is still to test hopefully 10% of the county over the course of the next couple months. I'm going to get Dr. Greiner over here. I can start to shift here a bit to the
Hi, Alan Greiner, Health Officer here at the Unified Government Public Health Department. So we've been working hard the last really week, but really hard the last few days on our phased reopening activities, but they all will come after what all of you are aware we've been calling our stay-at-home order. We have been under the governor's stay-at-home order, which people know expires this Sunday on May 3rd, and we believe she has a press conference later, and I think Mr. Bach mentioned this earlier. We'll learn more tonight, but we believe that her stay-at-home order will not be extended. we have had multiple conversations among the public health leaders across the entire Kansas City metropolitan community. And many of us, like Dr. Corvo and myself, have also been having meetings with public health leaders across the entire state of Kansas and interfacing with some of our contacts on the East and West Coast, trying to decide what makes the most sense. As many people will remember, about 10 days or so ago, the public health officers and public health directors from across the core 4 membership group of counties and cities in Kansas City came forward recommending a May 15th end to the stay-at-home orders. That was based on data we had at that time. We said openly at that time, if the data looks better and is looking relatively good, we may move that May 15th order forward in time. So we were having discussions about the data, trying to figure out what we were going to do with the state of Kansas governor's order for stay-at-home expiring on the 3rd. And as I'm sure most all of you are aware, then the city of Kansas City, Missouri, decided yesterday that they were going to move out of their stay-at-home order on May 6th. So they had a press conference yesterday, released some details about how they will start their phased reopening. We had already been sharing our documents from Restart WICO, which is our phased reopening plan with their public health leadership. So in response to that, all of us got back together, the public health leaders across the metro, and looked at the data again, had a discussion last night, and we all came to agreement that May 11th would be a good date for us to come to an agreement to release our stay-at-home order. So we are planning to have a joint press conference tomorrow to announce that we will move out of our stay-at-home orders at midnight on May 10th, so that the phased reopening activities will start on May 11th. I do feel like, and I think we all feel like, the data has improved. We are not seeing, we are not seeing a continued increase in hospitalization utilization. We are not seeing an increase in deaths. In fact, we are seeing a slight decrease over the past week to 10 days in both of those metrics. So hospitalizations and deaths, which are very important for us. We are seeing continued fluctuation in new cases, but it's hard to know exactly what that means because we're all ramping up testing across the metro. And here in Wyandotte, we're, as you heard already, we're really ramping up testing. So we've got to kind of watch all of the different numbers. And we feel confident that midnight May 10th is a good number to move into the phased reopening. So, and we will have lots of details on that in the next 24 hours as well. For folks that have contacts that are part of our Restart WICO task force group, about 25 community business leaders across the county. You may have heard some of these things. We've tried to dive really deep into details. We know that just like with our stay-at-home order, we may have to troubleshoot some issues with businesses or other entities in the coming days. But we feel like we're really getting there in terms of having the details. And in some ways, again, we felt like we were kind of a metro-wide leader in having our details on paper, being able to share those with the other counties. And in some cases, the other counties have really followed our lead in that effort. We've gone, and this is really Dr. Corvo's brainchild, we've gone with an image of a stoplight, so a sort of red, yellow, green set of what we're calling zones. So we will move from stay at home midnight May 10th to the red zone, which has still got a fairly strict number of requirements on all sorts of entities in our community. And when you see the detailed plan, you'll see that we go through every sector that we could imagine, from businesses to education to childcare to entertainment to parks, et cetera, et cetera. And then we move from zone to zone. Now, we have not exactly put forth a metric or a methodology that we will decide, okay, here's when we could move from red to yellow to green. And part of that is on purpose. We want to have the flexibility to keep looking at the different data and keep seeing what best practices may be in other countries across the world, as well as other states in the US. So this talks a little bit about those transitions. And you've heard me mention before the incidence data. So the number of cases we have are important. We also need to look in that second bullet, we need to look at the percentage positive rate of new cases that we're getting. So right now in our county, for the total number of tests that are being done, we're getting a relatively high positivity rate compared to surrounding counties and compared to other states in the US. So we would like to see, you presented earlier, that rate of 27% as a positive rate for the tests we're doing here at the health department. We would like to see that decline. So even if our numbers of cases go up, positivity rate declines, that's a good thing for us. But we'll continue to watch the hospitalization data as well and the mortality data. 14-day period is really because we do know now that the full length of incubation for this virus can be 14 days. So it can take up to 14 days for an individual who's been exposed and infected with the virus to start showing any symptoms. The average incubation period is 5 days, but it can be up to 14. So we really feel like that's the safe range to be watching this data. And if things go well, and we believe the state plan will be consistent with this, and we believe the other metro county plans will be consistent with this. If things are going well, everybody will be moving in lockstep forward with a 14-day zone change. Now, if things don't go well, it is possible we could have to backtrack and move to a zone that preceded the zone we're in. We have to have, as it says at the bottom, we've got to have adequate rapid diagnostic capacity, which we feel we're getting closer and closer to every day. We've got to have adequate healthcare facilities, and personal protective equipment, PPE, is still an issue. We're hearing lots of facilities and healthcare entities around that feel like, well, they might be okay for a week or 2 weeks, but we're all scrambling to try to get more resources from the state. People are trying to put in their own purchase orders, including the government here. So we've got to keep working on that. And then we've got to have that capacity to do the contact tracing that Elizabeth described. And we're working on a number of efforts to try to keep enhancing that. I think we're good. So I'm going to turn it over now to Julianne.
I get the pleasure of asking you for a large amount of money. So obviously, given that recap, you can understand this all requires a tremendous amount of resources, both in terms of staff, as well as just some influx of cash that we need. So I'm going to kind of go through this initial sheet, and then we'll talk about each of these items in a little bit more detail. First of all, testing. We are currently getting from KU 500 tests per week, and that includes both the supplies and the lab running those for us. They're currently not charging for us. Hopefully that situation remains the same. We're also getting about 100 to 200 tests a week from KDHE, which means we get both the swabs and the lab ability to run those tests for free. But there's still a gap. So if you think about our long-term goals for testing, we really are trying to get to a place where we're doing about 250 tests a day. And so there's still a gap in there after KU and KDHE helps us with testing. We still need to be conducting another 50 or so tests a day. And so that falls on us then to purchase those lab supplies and pay for that lab processing, which is about $50 per test. So there's a need for testing assistance. Personal protective equipment, which comes out of Matt's shop. We'll talk a little bit more about that. Contact tracing, which Elizabeth mentioned, we need some assistance with, as our volunteers fall off, we need some volunteer management assistance, as well as more EPI kind of expertise, project management, COVID call line, communications. I'll talk all about these in the next few slides. And then there are some other departments outside of the health department, obviously, who are impacted by COVID and need a little bit of funds as well. So this comes in near $1.25 million, which we know is a lot. We do want to preface it by saying, as most of you probably know, that so long as things go to plan, we should, emphasis on should, receive 75% of that reimbursed by the feds and another 10% by the state. So we really should only be out about 15% of this cost if we keep our due diligence and keep everything straight and if things go according to plan. So I just want to say that that's not a done deal, but that's what we should be reimbursed. Again, to go a little bit deeper, I kind of explained the testing. In terms of PPE, the number that we put there is for what we estimate to be about a 90-day supply of masks, gowns, gloves, face shields, hand sanitizer, and disinfectant. And this first and foremost goes to the health department staff who are conducting testing. And then secondly, to our first responders, including our police department and sheriff and fire as they need them. And then beyond that, when we have additional capacity, there are, like Dr. Greiner mentioned, a lot of healthcare providers in the community that are still struggling in this regard. So the number we have here is for 90 days. It's really difficult to really project the cost for PPE because it is changing daily, and it depends on who that day happens to have something in stock and can give you what price. So that'll kind of fluctuate as we go, but that's our anticipated need for 90 days. For contact tracing, we're really looking to get some personnel help in the form of a couple of masters of public health level professionals who have epidemiology training. So especially as we move towards this phased reopening, there's really the need for trained epidemiologists who can provide assistance to businesses who are reopening, who can assist in evaluating and intervening in those clusters and outbreaks that Elizabeth mentioned. So, you know, a lot of health departments have a staff of EPIs. We just have Elizabeth, who's doing a fantastic job with the assistance of Dr. Greiner and Dr. Corvo, but we know that these clusters are nowhere near over, and so we continue to need assistance with those. Also project management, which is kind of a hard thing to make a good sell for, but we're really in need of an additional kind of full-time FTE in the health department that can manage some of this COVID work. And it's a fluid position, and it includes things like managing our call line. We continue to identify technology solutions that we need to implement, managing a lot of the community engagement that we're doing, a lot of the data and dashboard and hub stuff. We're also doing a ton of collaborating with metro area health departments that takes a lot of time and capacity. So we're really just out capacitated in terms of who we have in this core team in the health department, and our bench is fairly shallow. So we're really hoping to get somebody in who can provide a little bit more of this high level project management stuff and kind of pick up, especially as some of us need to resume some of our original duties in the health department and can't spend 12 hours a day on COVID, you know, over the next year. As we try to get back to some normalcy in the next 3 to 6 months, it's going to continue to need some COVID project management support. I think we talked a little bit about this last time, but there's really a call from both the Health Equity Task Force and the larger community to set up a call line, and we're working hard on this, which would be a place where folks can call for any number of COVID-related questions. So 311 is already doing a fantastic job of triaging a whole host of COVID calls for us on a daily basis. We'd like to add to this so that folks can call into 311 and be hooked up with either a clinical health provider if it's a clinical COVID question, or with a community health worker if it's a social needs related question that can assist them with unemployment and with insurance applications and getting hooked up with the food needs that they have and all of those sorts of things. But that takes doing, and that takes considerable FTE in terms of who can really sit down with folks and meet those needs. So we're asking for some support for some community health workers over the next 6 months to try to meet that need. And then communications, and the number in here is from Alan Shop and the Sage Communications firm, and would include a whole host of things, including a PSA campaign about COVID generally, a testing campaign, media purchases, the printing and mailing, all of that kind of stuff that we know will be more important than ever as we go through this reopening process. I think that's all I have, right? I don't have further breakdown kind of on the other UG department expenses. I think Kathleen can speak to that perhaps a little later, but these are really the needs that we've identified in the health department if we want to continue with as robust of a response as we've had to date. Are there others from the health department that want to add to that?
Julianne, we might also just indicate that, you know, we have been putting in grant opportunities as they come about. We are submitting grant opportunities to the various different foundations and opportunities that as they come about, we are submitting to them as well. But these are the cost needs that we do estimate to have.
Absolutely, thank you. I think that's all for our formal presentation. I think I want to say another thank you to the health department team and to the larger UG team who've really shown a tremendous amount of teamwork on this, and also just kind of highlight our continual desire to walk this line between having a metro response to this, but also taking really carefully into account the Wyandotte County context that we live and work in. And so I think we've been doing a great job of that. I think an influx of resources will help us continue to do a great job. And I think we'll open it up for questions.
I'll just note in concluding on that budget piece, as she said, we anticipate getting 85% of that back. So that does put it at about 186,000. We are budgeting this. Well, we'll move it through. We have to front the expenses to move through and pay for this, but that's how we'll handle it. I'll also note this team has done an outstanding job, and I think I will recognize Commissioner McKernan, who has probably more to say there.
Thank you, Mr. Bach. I do want to take a moment because I have had the opportunity over the last couple of weeks to work really closely with the team on the Restart Whiteco. And I think we need to really acknowledge and applaud and thank that entire team for all the work that they've done so far and the work that they're continuing to do even as of today. Certainly our community partners from not only business, but also from education and from other sectors of the community, from some of our civic leadership centers in the community. We have to really thank them because these folks not only came together and gave us a lot of their time, they moved on a dime. If we called on a Thursday night at 4:30 and said, we're having a meeting tomorrow morning at 8 o'clock, they were there. All of them were there. So tremendous dedication and tremendous caring from them in terms of creating the plan and the guidelines that will help to move us forward. Certainly want to acknowledge Mayor Alvey and you, Mr. Bach, and the folks in your two respective offices for bringing this all together and asking us to create these guidelines, because it's your leadership that is helping us to take this forward. Certainly from your office, Doug, I want to thank Rocky Mays. She has sent way too many late night emails, and hopefully we can curtail that now that we're past a little bit of this. I really want to go over to our health, and I have to turn over here to see him on my screen, but our folks from the health department are absolutely incredible. And I know that over the years, maybe they've been a little bit invisible to all of us commissioners. And I want to say that we really owe them a huge debt of gratitude for their very hard ongoing work. Our two medical officers, Dr. Greiner and Dr. Corriveau, are incredible. The amount of work they've put in, but the quality of the work and the care that they've taken in helping us to be really not only strategic, but also really caring as we roll out these guidelines. So a huge thanks to our two medical officers who have led this Restart team. Also, thanks to everybody in the health department. Tonight, we've heard from Terry Garrison and Julianne Van Loo, and they've also put in a ton of time, and we want to make sure that we thank them and all of their respective offices. We have our two public information officers, Janelle Friesen, who we've heard from tonight, as well as Dave Reno, and their respective staffs have really worked hard on this. And so, commissioners, I know that you've seen the guidelines, or at least a draft yesterday. And I think what you'll appreciate from those guidelines is that this team worked to try to make the guidelines as comprehensive as possible, to give as much guidance as possible, which has made them, I think, in excess of 50 pages. But they've organized it in such a way that any person or any group can quickly drill down and find the very specific information that applies to them and their group. And so I'm very proud of the work that they've done. I think they've given us a good template and a good guideline to help us move forward while still respecting the fact that this virus is sneaky. So we don't want to let it get the upper hand again. Thank you, Mr. Bach. That's all I have.
Thank you, Commissioner. I will note the guidelines have been sent out and they're available for the public. If they want to go access those, they can go to our website, and we've sent those out to the media as well. So they're out in the public's hands for people to go through and look at and see how we'll be staging this after we move past the May 10th stay-at-home order. Mayor, I'd next like to move, I don't have any other questions up from the commission. We would like to move into a little bit of a budget update that's related to COVID before we go to our next topic. Unless you would like more information or you would like us to pull up the guidelines on that are issued.
No, I think we move on to the revenue forecast.
Okay. Rocky, if I can get you to pull that screen up, and we'll note as we turn this, thank you again to the health department and everyone that participated on moving us to the place we are now. And also a thank you to Commissioner McKernan for all the time he invested, as he thanked everybody else. He invested a lot of his own time in working through this and responded a lot of the late nights and working through. So we just wanted to do a couple slides tonight to talk about the revenue impact of where we're at as we continue to do additional analysis on everything that's going on from a financial perspective. Picture doesn't get any better from day to day. So not only do we have increasing cost of over $1 million that are coming into play, our revenue picture continues to go down. So we wanted to give you our latest update to where we are. We are going to spend more time next week when we move into our budget workshop. So just note this is a very brief summary of where we're going through things, and then we'll dig into this in more detail next week as we move forward. With that, I'm going to recognize our Chief Financial Officer, Kathleen Bonacci.
Thank you, Doug. So my finance team and having talked with all our operating departments and a variety of stakeholders out in the community, we have determined a preliminary revenue impact analysis of the COVID-19 closures that have taken place that began in April or mid-March. And this revenue impact includes assumptions through the middle of next year, 2021. So based on that analysis.
Kathleen, I'm sorry, I'm going to interrupt you.
Yes.
Apparently Commissioner Burrows was trying to raise his hand on the system and it was not coming through. So I'm going to let him recognize his questions back on the health department's presentation before we advance to that. Commissioner Burrows.
Thank you, Mr. Bach. I just have 3 questions, and I sincerely appreciate all the work effort. I know that 50 pages is quite a tremendous amount of work for people, especially the public, to work through. But I know it was stated that there were issues that we were going to allow in the plan for compliance, but what teeth do we have in place for compliance of our orders? If people don't want to comply or businesses don't comply, what teeth do we have in that, or what actions can we take?
I will recognize Ken Moore, our county attorney, chief counsel, who can talk about that a little bit, as we do have that in place. Ken?
Well, Commissioner Burrows, as you recall, maybe a month ago, we did adopt an amendment to our health ordinances, which made it a misdemeanor violation to violate a local health order. So by adopting this plan and making it requirements, then a violation of that would be that it's an unclassified misdemeanor, punishable by up to a $500 fine and a 30-day jail sentence. As we always have done in the past, though, the first step in anything would be an education component. And so far, we've had great success with our police department and health personnel and Dr. Griner in getting voluntary compliance once we notify people that they're in violation. But if it persists, then we have the capability to issue a municipal court citation for violation of the order.
Thank you, Mr. Moore. And I really think that's important that the public understand and know what those violation ramifications may be. The second part is I'm very supportive of the 85% funding mechanism, and I'm strongly in support of that. I believe that is very beneficial for our community. The next question I have is for the health department. I have requested for the last couple of weeks possibly a pop-up for Bonner Springs and Edwardsville area, the furthest west points of Wyandotte County. Our community is sorely in need of testing out west, and I would hope that that would strongly be considered as we move forward for pop-up testing.
Yeah, I can take that one. I know that Commissioner Burrows, that we've had discussions with our health equity task force group about making sure that we're covering the geography of the county. They are well aware of that need. And I think right now we kind of are still in upswing mode with the pop-ups. We actually just heard today that Vibrant Health, which has committed to 2 to 3 pop-ups a week, is willing and has the testing resources just newly given to them to go to 5 days a week. So that will really help us in getting out to the western side of the county. So that will not be neglected. We are wanting to follow that group's guidance to some extent, though, so that we can say that we're truly asking the community itself what they feel is needed. Part of that is because as all of the folks on this call know, we have already seen some disparities in who's most affected by this disease, both in terms of the case count and the mortality. So we will keep pushing that, and we're happy to keep discussing things as well, doing more to map out cases, as well as map out, as Julianne showed, map out the testing sites.
And thank you, Dr. Greiner. I sincerely respect and appreciate your comments. I would just be remiss as a commissioner at large not to recognize the fact that Western Wyandotte County is also part of our community, and they too deserve the resources necessary to ensure their public health and safety is considered.
Thank you, Commissioner Burrows. Commissioner Kane?
I want to echo what Commissioner Burrows said about testing out west here. I think Oak Ridge Baptist Church would be a really good place. And I've already had people asking, when are they going to do one out here? Because we've got, obviously not just to the east of us a little bit is where there's a cluster. So I'd like to see that as early as next week.
Thank you, Commissioner. I think that's good information to take back to the task force as they work on their future sightings. Okay, with that, Kathleen, I'll go back and recognize you as you had started into your presentation.
All right, so as I was mentioning, so the revenue impact that we have estimated is significant. Before I show you this next screen, I do want to remind everyone that all of the efforts that the unified government is undertaking, and in conjunction with the governor's office through the business closures and shelter in place, it's all aimed at saving lives. We don't know how many lives have been saved through these efforts, but that's the most important thing, the priority, and how much money we have not collected in terms of an organization is secondary to the saving lives. So we have done an estimate of the estimated revenue impact, revenue loss as a result of this. And of course, the reason is because much of our revenue is very dependent on the economic activity of our community. So we have a variety of funds, and for simplicity, I've broken them into 2 categories. The general fund, where most of our public safety operations occurs, and then all other funds, including our sewer system, the tourism and convention, transient guest tax, the dedicated sales tax, which also supports our public safety. Whole variety of funds are here in this other funds category. And I've broken it up by the impact in 2020 and then the impact in 2021. The estimate anticipates that there will be some impact at least through the middle of next year. So within each year, I have 2 cases. You might consider them best and worst case. In 2020, the first column is the 2-month shelter in place estimate and then the second column is a third month and then a fall wave assumption. And then in 2021, there's best and worst case. So in 2020, we're estimating that in total, the unified government can be losing in revenue a range of $25 to $35 million. Please keep in mind that $35 million is roughly about 8.5% of the total general fund. I'm sorry, the total unified government's budget. So 35 million seems like a lot of money, and it is, but it represents roughly 8.5% of the total. In 2021, we're anticipating a range of 10 to 22 million. Now, my assumptions for these various cases are as such. In 2020, the first case, the 2-month shelter in place, assumes that we would be closed through the middle of March through mid-May, and that the closure would be followed by a strong economic resumption. The 3rd month shelter in place assumes that there's an additional month of closure sometime in May due to virus community spread and consumer reluctance to resume normal retail activity. So as you've probably all already heard, it's kind of a cliche that it's best to hope for the best, but plan for the worst. So we're hoping that the 2-month shelter in place scenario occurs, but we need to plan for the worst. In 2021, the best case is that a vaccine is found in the early part of 2021 year. We assume consumers are gradually resuming normal activity, a modest growth in assessed value, improved by slightly depressed retail activity, and residential collection delays due to high unemployment. The worst case is that a vaccine is not found until June, and that the community spread continues, and which will result in just slower economic growth, limited travel, gas prices still being low, and depressed retail activity in that second year, or at least the first half of the second year. So that's what these assumptions are. If we're in the best case situation, we're anticipating the 25 million in 2020 plus potentially a $10 million impact at the beginning of 2021. So the next slide, I talk about how I got here, a little bit more on the assumptions. Basically, sales tax reliant governmental funds are deeply impacted. That's the city general fund, not the county general fund, which is highly reliant on property tax. But the city general fund, the dedicated sales tax fund, the EMS fund, and the alcohol tax fund, among others. Now, unfortunately, it's been very difficult. We don't have actual data from the state yet. We won't receive it until at least the end of June at the earliest. So we are looking into trying ways to find some data that we can base better revenue assumptions on. But in the meantime, what we did was we collected sales tax vendor data from prior years and conducted a comprehensive review. And we reviewed that prior data by NAIC business classifications. There are about 16 different business classifications, including retail and food and accommodations and many others, right? And we looked at all of our prior sales tax data by month as it was collected for the prior year and by NAICS business classification. So we assumed, and so my team, there's about 3 of us, we all looked at this individually ourselves, and then we formed a consensus. And we assumed various activity levels for each month between April of 2020 through June of 21, and we did it by classification. So basically around 300 different data points, and 3 of us worked on it independently. So, you know, it's about as close as we can get, given we don't have a lot of data already. What we determined actually is that the STAR, or the Legends area, where the formerly known STAR revenue, is potentially going to be down 37% due to a majority of the remittance in that area being in the retail business class. And we did assume that use tax revenues would be increasing due to greater level of online sales and deliveries. And, not just in 2020, in the worst case scenario, we assumed that there would be no Kansas City sporting games or no audience for the NASCAR races. Of course, we don't really know that because they haven't made that decision yet. So, but we had to plan for the worst. So now property tax is less impacted, except that we're anticipating some delays in collections due to the unemployment rate increasing. And it may have an impact on property values in 2021 or 2022. We're assuming a slowdown or a drop in water, electric, and sewer consumption levels because many of the commercial properties have been not in commission the last few months. So we are anticipating that revenue drop off. As you know, the broader market has also, in addition, experienced a significant drop in gas prices, which occurred in the middle of March. It was a 40% drop in gas prices. And not only that, but people really aren't traveling anymore, or a lot. So the revenues we're expecting from the highway gas tax that is collected by and distributed by the state is expected to be significantly or cut in half, frankly. So hotel occupancy also has dropped by 60% by the Kansas City, Kansas Convention and Visitors Bureaus. So that it greatly impacts our transient guest tax. So those are just some of the highlights. There are many other revenue accounts that are going to be impacted, such as building permits and inspections, potentially recreation and park shelters. And so because utilization will be different than it has in the past. So initially we have undertaken a number of preliminary budgetary actions. First off, we're reviewing the long-term financial plan of our unified government. Secondly, we are identifying programs with the help and the assistance of the commission. We have identified programs for business process reengineering, utilizing priority-based budgeting as a tool. We've identified, we're identifying, continuing to identify grants and reimbursement funding opportunities to offset the COVID impacts. And we're conducting cash flow analysis to determine whether our liquidity needs are going to be met. And then also, finally, we're implementing some near-term cash savings measures. And of course, these are all one-time measures. So as part of the budget process that we are in the midst of, we are not only evaluating the budgetary impacts and where we can find savings, not only short-term but long-term, but we're also instituting the following cash saving measures. So first off, we are, based on the direction from our administration, we have suspended or we're suspending the hiring of non-public safety positions. And that we're not, it's basically a hiring slowdown because there will be key areas where positions will be filled where where the need is demonstrated. The second thing we're doing is we're reducing operating expenses back to the 2019 actual spending level. That operating expenses refers basically to non-personnel, non-capital areas. So, and then in addition, we are reviewing all of the cash capital funded projects to determine which ones can be either taken off the list or moved out to a future year. And then lastly, there's no doubt we will be utilizing our emergency reserves because the depth of the revenue loss is much more than we can recover in just 1 year. And that's why we have that the budgetary reserve policy where it puts in place that, you have that 2-month reserve so that if an emergency like this happens, you're ready and you're able to at least accommodate some of its impact. So at the end of 2019, we calculated that our emergency reserve was at 20% of total expenditures roughly. And the reserve policy, which is almost, it's about 8.5% of total general fund revenues. So that will be of great assistance. Of course, we can't wholly rely on dipping into our reserves. So we will be embarking on a difficult or challenging but insightful process to review our organization and see how we can perhaps provide services more efficiently. And so with that, of course, always keeping in mind, we want to diminish the impact to our employees who are also residents of our community.
Thank you, Kathleen. Appreciate that overview of where we're at. And as she's noted, there are several measures we are instituting right away. We are certainly not in a position to go after new things, it seems like right now. So we are cutting back in other areas. We're trying not to reduce service delivery in certain areas, though that may be something we'll have to go into in more detail and look at some areas where we may have to cut back in some of our service delivery we have to do for the remainder of 20 in order to keep things on track for the balancing that we're trying to do with all of this. Commissioner Johnson?
Yes, thank you, Kathleen, for that presentation. I really appreciate it. This question is to you and to Doug. What assumptions, and you may have said it, I always, kind of preface my comments by saying this, you may have said it and I just missed it, but what assumption do your projections make relative to mill levies for 2021, if any?
The assumption there is that the mill levy stays the same.
Perfect, thank you.
Okay, so as we said, we will continue to look for ways to find efficiencies in our operations, and we will probably have some service deliveries where we'll have to tighten back and pull back on into the coming year, and we'll have to look at all different areas for that. But we wanted to give you an update of where we are. I'm going to ask Mike Taylor if you'll give us a quick overview of some of the things we're looking at for different revenue offsets coming from a legislative perspective. Mike?
Yes, thank you. Good evening. I was on a call just actually less than an hour ago with Senator Moran and got his latest take on things, which is kind of what we've been hearing from the federal side of things. Today, House Speaker Nancy Pelosi suggested that the next COVID bill should include $1 trillion for states and cities. On the other hand, on the Senate side, Senate President Mitch McConnell has suggested that states should just be allowed to go bankrupt. I think we're going to land somewhere in the middle on that. A bipartisan bill has been introduced by Senator Cassidy from Louisiana, who's a Republican, and Senator Menendez from New Jersey, that would put $500 billion into a bill, the next COVID bill, for direct assistance to states and cities. House side has one that would be $250 billion. So we'll probably land somewhere in the middle. And one of the things that I think we're likely to see is concern. Already the Congress has spent $2 trillion on COVID relief, and they're starting to get worried suddenly about the federal debt and the deficit in the federal debt. So they're going to start looking closely at that. But one of the inside political things that you're going to see happen, I think, is Senator McConnell is very interested in limiting business liability so that businesses that do reopen when local communities start that they won't have employees or customers suing them. And he's likely to use that as a leveraging tool on the municipal funding piece. So there's going to be a lot of politics, no surprise, involved, but we're working it, and there seems to be support that yes, there needs to be some help for our cities and counties because we're really on the front lines in a lot of ways of this. Quickly from the state level, Johnson and Sedgwick County got a couple $100 million under the original bill. We have gotten, by the way, on any next federal thing, reduced from the 500,000 population to 50,000, which is very beneficial to us. So hopefully, if they do put funding in, we'll actually be able to qualify for that because of not hindered by the population limits. The state is looking at a $1.2 billion revenue shortfall. They got 736 million in funding from the feds. We've been in discussions with them about how are you going to distribute that money. And Larry Campbell, who's the state budget director, has said he's going to set up a task force. He will include League of Municipalities, Association of Counties, and other municipals to help have input into how the state should divide up that money if they decide to divide it up at all. They may just decide to keep it all themselves. We just don't know that yet. But that's kind of the update. Oh, and the legislature, so Congress was supposed to come back next week and start working on this next bill. Majority Leader Hoyer said that Congress, the House, will not meet next week based on the congressional physician's recommendation that putting 435 people together in close quarters was probably not a good idea. The Senate is going to return next week, and so they'll start working on some things, but we won't see any final action for probably another 4 or 5 weeks at least. State legislature may return next week. We're not sure. We've got some final steps they need to take in terms of the state budget. So we may see them come back, and if they do, we may see some discussion about helping local. So everything's really kind of uncertain and it's very political, but there's a lot of groups pushing to help get some funding and relief for revenue losses for cities and counties.
All right, thank you, Mike. Just to note that, I mean, so a lot of work going on in the different state houses at federal level trying to get money, and we also know that we hear every day from our Senate and representative leaders that they're working for us to get that money back here as well. So thank you for that update, Mike.
Thank you.
Commissioner Burrows, you have a question?
No, thank you, Doug. I had questions prior to this presentation, but that's fine.
Okay, thank you. Mayor, I believe that concludes that part of the update, so I don't see any other questions. Would you like us to move on to the next section of the special session?
Yes, I do. But before we begin, I want to say that because we needed to do this COVID update and provide the additional information about the revenue projections, I was concerned that this might go a little bit longer. So I understand that there are a lot of people who want to weigh in on the fire station update. And so just before we move into this, that there will be an opportunity. If people do not feel they have an opportunity to weigh in today, we will pick this up again next week, the fire station piece. Thank you.
Thank you, Mayor. And as we close out the other update, I'll just know that we will have that press conference tomorrow morning at 10 a.m. So that'll be the opportunity for the medical officers to come forward and present the information in a joint way between the 3 counties and their selection of the date where they're going. Okay, so now we're ready. We've been working for some time, several years, as we've moving through looking at locations of where we can most efficiently locate fire stations within Kansas City, Kansas. We've been looking at that from a perspective of what we can do to build some new ones where we've had old aging infrastructure in place. Currently where we have a new one getting ready to come online. So we have a full report on this to go through, talk about it, talk about the most efficient locations where we can put them, and then how we'll be doing relocating to staff our new fire station as far as we've done our analysis to make that move forward. So with that, we have with us Fire Department Chief Callahan on the line. So I'll recognize Chief Callahan to take us through the presentation of the analysis of what you have. Chief?
Good evening. I'm Mike Callahan. I'm the Fire Chief of the Kansas City, Kansas Fire Department. I'm going to pull this presentation up. So as the administrator stated, we've been working on this for quite some time, and this is the KCKFD strategic plan. Okay, I'm sorry, I gotta go back one. So what we're going to be discussing this evening is future station construction and location, staffing of the new Station 12 in Piper, and enhancing response capability.
Chief, I don't believe we can see your presentation yet.
Okay. Let me get on
And
here.
he also needs to move closer to the mic.
Okay. Let me try something here. Let's try it now. How's that?
There you go.
Okay. So we're going to be discussing those three things I just mentioned: future station construction and location, staffing of Station 12, and enhancing response capability throughout the city. Quick update on our COVID-19 as it pertains to the fire department, our response. Currently, the KCKFDs have no positive COVID-19 tests, and we have no members in quarantine. The entire KCKFD has stepped up and demonstrated the utmost dedication and extraordinary efforts during this trying and difficult time. On a special note, our EMS division, in conjunction with our logistics division, did an outstanding job beginning in January of pre-ordering, pre-staging, and delivering PPE supplies before supply chains worldwide became choked or interrupted, which we're all experiencing now. The KCKFD anticipates that our PPE supplies will remain sufficient for the duration of the pandemic.
Chief, your audio is not real good. I mean, if there's a way for you to get closer to your mic, however that's set up in there, you're not coming across real well.
Okay, let me see. I have to pull this in. It might affect the picture, but is that any better? Is
Yeah,
that
I
any
think
better?
that's better.
Okay. So our enhanced public safety, health and safety for firefighters and our public has consisted of some of the following initiatives throughout the year. In furtherance of our firefighter cancer reduction initiative, the department purchased and distributed the following: 2 sets of bunker gear for all firefighters. That's so one can be cleaned and get the carcinogens off, and they can wear the other one while that one's being cleaned. 2 protective hoods for all firefighters, same premise. A self-contained bunker gear carrying bag to all firefighters so that they can store their gear in a bag, unexposed. Ventilated bunker gear lockers for all fire stations to permit airflow through those lockers. Carcinogen extracting bunker gear washers for most fire stations so that the gear can be washed and cleaned. And Plymavent diesel exhaust systems have been installed at several stations that previously did not have them to extract the diesel exhaust from the apparatus starting up. I apologize for that. We've also attempted to improve our readiness by purchasing 4 new pumpers, 4 new trucks, and 2 ambulances. We've increased the AOR covered by 4 and 8-minute response times in the city that's area of response. We've initiated the first ever mutual auto aid agreements with neighboring jurisdictions for a supplemented response. We've initiated the first ever interdepartmental training with neighboring jurisdictions for collaborative instruction so that we train the same way and we all understand and speak in common parlance. We've equipped each firefighter with an integrated thermal imaging camera, a TIC as it's called in the fire service, so that they can see and read heat readings in buildings that are on fire. We've equipped all of our truck companies with hydraulic extrication tools. These are the tools that are utilized when there's an entrapment with a vehicular accident, say on an expressway. And these are the tools that the firefighters utilize to extricate individuals from those vehicles.
Chief, your audio is kind of fading again.
Okay, we've delivered robust and recurrent training on emerging fire service trends. We've also increased the number of KCKFD personnel responding citywide on every type of alarm. We've also maintained our fiduciary responsibility. Fire and EMS make up 15.3% of the total UG budget, which is about $61 million. In an effort to be the best stewards of those funds, the departments implemented telestaff, an automated manpower program to streamline and more efficiently manage the daily staffing and overtime operations of the department. We've also implemented a cyclical apparatus replacement program to ensure greater compliance with NFPA 1901 guidance and reduce repair and maintenance costs at the same time. We've implemented a lease turn-in program for fire apparatus to rotate the apparatus that have the highest call volume, thereby reducing repair and maintenance costs for those specific apparatus. By purchasing a new type of pumper or new pumper type, we reduce the overall cost of a purchase of a pumper by about $200,000 per purchase per unit. So we're going to go into the KCKFD station location plan now. This is the current 4 and 8 minute response in the city of Kansas City, Kansas. The red indicates areas that are covered within 4 minutes. The green indicates areas that are covered within 8 minutes, 4 to 8 minutes. So currently we're looking to build a new station in Turner and combine stations 16 and 17. The current stations were constructed as township volunteer stations in 1940 and 1955 respectively. As these stations were constructed for volunteer fire departments, they never were really meant to house a paid professional platoon scheduled fire department. Our goal is to construct a new station in Turner for pumpers 16 and 17 on UG land in Pearson Park next year. One of those companies would remain a pumper. That's the apparatus that brings the water and hose. The other would become an aerial apparatus, a truck. That's the apparatus that's responsible for rescue, ventilation, and forcible entry. Structural fires require both a pumper and a truck to effectively and expeditiously suppress and extinguish the fire. Although pumpers and trucks have unique tactical assignments, those assignments are complementary and require collaboration to achieve the overall strategic objective of putting out the fire. EMS 17, currently housed in Station 17, would also be relocated to this new Turner station. The current 4 and 8 minute travel time distribution you're looking at here assumes the opening of new Station 12. But for purposes of this discussion, we're talking about this area right down here. The proposed Pearson Park station would be here, and this would then be the 4 and 8 minute response boundaries in that area. After the next station, we hope to construct the Station 20 in Muncie. That's currently at 78th in Kansas. We'd like to construct that station in 2023. The current Station 20 was constructed again as a township volunteer station in 1967. This Station 2 was constructed for a volunteer fire department. It was never meant to house that same paid professional platoon scheduled fire department that we operate here. Presently, Station 20 has been repaired and refurbished to the greatest degree possible. Some significant issues that remain, however, include the structural integrity of the building compromised by rotted, deteriorated, and shifting roof trusses, which cause walls to shift and crack. Increased settling has caused ongoing drainage and plumbing issues. The building space and size limits it to only enough size to have 1 bathroom in the building. So the GIS mapping has indicated that the best location for Station 20, and this hasn't been selected yet, this is ballpark, would be somewhere in this area, a little bit south of where they're at right now. So the geospatial analysis indicates that that would be a place to look for land for this station. The new Station 4 in Bethel, currently Station 4 is on 81st and Leavenworth. We're looking to construct a new station in 2025 for Pumper 4. Current Station 4, again, you see a thematic commonality here, was a township volunteer station constructed in 1957. Same problems as before, never meant to house a platoon scheduled paid professional department like ours. Presently, again, Station 4 has been repaired and refurbished to the greatest degree possible. The significant issues that remain there include retaining wall collapse towards the station, increased settling that's caused ongoing drainage and plumbing issues. As a result, the water frequently drains toward the living quarters, causing continual water intrusion and mold that has to be remediated. Station 4 would be built in collaboration with the KCKPD traffic division structure. So we're talking about this area here now, and Station 4, the geospatial data analysis indicates that that station would be best located just a little bit east of where it's at right now. Again, no land has been purchased for that station and no location has been selected. It's just, right now, it's just in the mapping phase. So the impact of the proposed station locations that we've just discussed, and this is only the stations we just discussed, 16 and 17 in Turner, Pumper 20 in Muncie, and Pumper 4 up in Bethel. This would be the 4 and 8 minute response matrix for these companies individually, and then this is the 8 minute response matrix for those companies if the companies were relocated to where the GIS geospatial analysis indicates that they should be placed. So our next topic is adjusting fire response to meet emerging needs, continuing high quality coverage in the Fairfax industrial area, and while concurrently staffing a new station in western Wyandotte County. This is the Station 12 build timeline, approximately approved for the budget. In 2016, it was approved for the 2017 budget. Spring of 2017, land acquisition was sought. March of 18, purchased the land. May of 18, request for qualifications for an architectural firm. August of 18, same RFQ for a construction manager at risk. Ground was broken in April of 2019. Station 12 is scheduled approximately in early June to open. The principles and standards that were utilized for adjusting the response matrices. We were given direction to utilize the existing number of fire and EMS companies. Determine the methodology needed to ensure maximum reliable fire and EMS coverage for the entire city. Utilize data-driven decisions that aim to enhance coverage while ensuring fiscal pragmatism. Determine the locations and configurations that provide the best speed and weight of response for the entire city. Those are terms of art. The speed in the fire service is the arrival of the first unit. The weight is the arrival of the balance of the response that is sent to that location. So we endeavored to do this by conducting a rigorous GIS and response evaluation, utilizing the data analytics to verify which existing fire and EMS companies can be relocated to improve existing response coverage for the entire city. Continuing regular periodic reviews of data analytics to assist with recurring response coverage examination as demographics in the city continue to shift. Staffing of Station 12. The new Station 12 is located at 2913 Hutton Road in western Wyandotte County. Is slated to open. It says May here, but it's probably going to be early June. The fire department was tasked with staffing Station 12 by relocating an existing fire company. The KCKFD conducted data analysis to determine which existing fire company could be relocated without impacting or minimally impacting existing response coverage. This analysis suggested 3 potential companies for relocation. The companies identified were Quint 3, Pumper 10, and Pumper 15. These companies are positioned on the extreme eastern, southeastern, and northeastern boundaries of KCK respectively. Consequently, their areas of response are extremely truncated. This is the current 4 and 8 minute response matrix for the city of Kansas City, Kansas, absent Station 12, which was shown in an earlier slide out here. We've taken it out for purposes of this discussion. These are the current companies. Again, red, 0 to 4 minute response time, green, 4 to 8 minute response time. Quint 3, 4 minute travel time. This is the current location of Quint 3, right here. You can see the red around the station right now. That means they can get there in 0 to 4 minutes. The next slide will show Quint 3 not there. You can see that there's a large segment of white that opens around the firehouse. That means that they can't cover that. A company surrounding the current Quint 3 could not get to that area in 8 minutes. Certainly can't get there in 0 to 4 minutes. Quint 3 also responded to 1,321 emergency responses in their territory in 2019. 1,321 responses. The next slide shows Pumper 10 near KU Medical. This is Pumper 10 down here. The next slide is going to show what this area looks like if Pumper 10 isn't there. As you can see, the white around this area is again open significantly, meaning that these other companies cannot get into this area in 0 to 4 minutes or 4 to 8 minutes. Pumper 10 also responded to 1,638 emergency responses in 2019. Next station is Pumper 15, the Fairfax Industrial District. This is Pumper 15 up here. The next slide is going to show the response matrix if Pumper 15 were removed. As you can see, there's no degradation in 0 to 4 minute response time by relocating or moving Pumper 15. In 2019, Pumper 15 responded to 286 total emergency responses for the year. The GIS and activity analysis reveals relocating either Quint 3 on Kansas Avenue or Pumper 10 at KU Med creates a tactical breach because no other company can completely cover the existing area of response of Quint 3 or Pumper 10. Response analysis reveals that the response territories of Quint 3 and Pumper 10 are 361% and 474% more active than the territory of Pumper 15. Relocating Pumper 15 does not create a tactical breach because its territory can be covered to NFPA standards by Station 5 in Quindaro, on Quindaro, I'm sorry. Relocating Pumper 15 does not create any tactical breach in the coverage of the existing area of response. Pumper 15, the recommendation of the department is to relocate Pumper 15 to the new Station 12 on Hutton Road. Pumper 15 is the least active fire company in the city. In 2019, they had a total of 286 emergency responses in their territory. You can see the breakdown: 18 fire calls, 181 EMS calls, 6 hazmat, and 81 canceled or false alarm. These responses equate to 0.78 emergency responses per day, 3/4 of 1 response per day. Pumper 15's current area of response would remain protected without any reduction of service within the NFPA 4-minute standard of cover by Pumper 5, located at Station 5 on Quindaro Boulevard. So this is the response matrix without the new Station 12 out on Hutton Road. This is the area we're talking about right here. This is the new pumper 12. Out, you can see that the 0 to 4 minute response time and the 4 to 8 minute response time have significantly been helped by placing pumper 12 where it's going to be placed. Fairfax industrial area coverage, same or faster response times. Station 5 can access Fairfax from 3 directions: 10th Street, 7th Street, or Quindaro Boulevard. Fairfax remains covered by 4 minute response time in accordance with NFPA standard. Same speed of medical response. Fairfax EMS transports will continue to be run by EMS 5 as they are now. More weight to the fire response. So enhancing Station 5 on Quindaro, putting 4 firefighters on that pumper, allowing faster attack on interior structure fires is part of this plan, as well as converting pumpers 9 and pumper 11, which are also Fairfax responding companies, to 4 firefighter pumpers. This increases the total weight of the crews responding. KCKFD recently increased the number of personnel responding to a general alarm, which is any commercial structure in Fairfax, to 33 firefighters, up from the previous standard of 25, and we're planning to increase that number to 36 to 37. Fairfax fire calls will be run by Pumper 5, 910 Quindaro Boulevard, Pumper 1 on 6th Street, Pumper 9 on Central, Pumper 11 on State, and the truck companies or aerials are Truck 1 on 6th Street, Quint 3 on Kansas, and Truck 14 on 27. Excuse me. These are the response routes that responding companies other than Pumper 15 would take into the Fairfax industrial area. The GM plant fastest response company is 2.1 miles away. The Tanker Farms fastest response, 1.4 miles away. NFPA 1710 and OSHA standards, talk a little bit about that. The department is currently seeking authorization to hire 18 new firefighters. If authorized, these firefighters would be utilized to convert 6 of our current 3 firefighter pumpers into 4 firefighter pumpers. This would allow the department to conform with the NFPA 1710 standard for the arrival of a fire company within 4 minutes, as well as the contemporaneous standard to place 4 firefighters on the scene within 4 minutes. This would also comply with the OSHA regulation of 2 in and 2 out at a fire scene. The SAFER grant, the department is making application for the staffing for adequate fire and emergency response. It's a SAFER grant in furtherance of our efforts to more fully comply with the NFPA 1710 standard and OSHA 2 in 2 out regulations. Pending approval, application for the 2020 SAFER grant, if awarded, would reduce our initial fiscal expenditures for those 18 firefighters we mentioned in the first 3 years by 75%, 75%, and 35% respectively. Year 1 cost of the UG for those firefighters is $259,000, same cost in year 2. Year 3, it goes up because the grant award drops to 35%, goes up to about $673,000. Total 3-year initial cost savings for those hires about $1.9 million. We're also intending to relocate an ambulance to the new Station 12 to ensure comprehensive EMS resources are available to every segment of the city. We're looking to relocate EMS 19 to Station 12. It's our recommendation to relocate EMS 19, currently at 1011 North 80th Terrace around 80th and State, to the new Station 12 on Hutton Road. The current EMS transport response provided by EMS 19 will be covered by EMS 6, 98th and State, EMS 2, 62nd and State. The current standard of a 9:59 arrival time for an EMS transport unit will be maintained in the areas currently served. The current standard of 9:59 arrival time for an EMS transport time will be expanded into areas that are currently not served in that time. This will provide more comprehensive EMS transport capability to the west and northwest sides of the city. It's the current location of EMS 19. This is EMS 2, this is EMS 6, right in the middle. This is what it would look like relocated to the new Station 12. What you're seeing here is the ability for an ambulance, an EMS unit, to reach a given area in the 959 standard. These, as you can see, this relocating the ambulance to Station 12 provides a much greater ability for an EMS transport unit to get into those north and northwest sections of the city much more significantly than we can currently serve them. So with the proposed, these are the 4 and 8 minute travel time boundaries utilizing the recommended station relocations. The new Station 12 is here, Pumper 15 is not here, and these are the recommended locations we went over: Pumper 4, Bethel, Pumper 20, Muncie, 16 and 17 in Turner. That concludes this presentation.
Mayor, at this point, we don't have any questions from the commissioners, though I think we may have residents that have signed on since you made this available for people to talk during this special session.
Thank you. I do want to say that we will have opportunities again next week. I believe it's next week to take this up further so that those who are viewing this, it's a good opportunity for us to kind of dig into it a little more deeply. If you have any questions, feel free to send those questions in over the course of the week. We certainly want to engage the conversation. It's a very important thing moving forward. We want to have good discussion, conversation about this. I will say, if you, the public, if you want to speak, please state your name and city of residency, and then also be aware you have we're limited to 3 minutes. So, Bridget, do we have anyone from the public who would like to speak at this point?
I think
Hi, Mayor.
Commissioner Townsend has raised her hand first, I guess, so I probably should recognize her. Commissioner
Sure.
Townsend.
Thank you. Finally unmuted. I appreciate that the mayor is going to allow for public comment. Therefore, I'm not going to spend a lot of time talking about that. I appreciate that we're going to revisit this again next week, because I think on so many levels, it needs a fuller and deeper opportunity for discussion. I'll take this time also to note for the record, everything that's been discussed tonight has been so impactful and of such serious nature that I was on the call from the beginning, but had trouble unmuting for some reason this. So I just wanted that on the record, but I'm not going to take up any more time and defer to callers on the line about this. And I appreciate the administrator and the mayor allowing for this public access, and that we will revisit this again next week. Thank you.
Bridget, do you want to call on the members of the public, or you want me to?
I only see just 3 names raised. I don't think I have the access to the names, but I did receive one email from Clarence E. Brown, who would like to ask a question or make a comment if he's online.
I don't have that, but I think I can recognize the other members of the public that are here right now that are ready. So I see Melissa Clark.
Can you hear me?
Can.
Okay. Sorry, I just walked back into my house. I am selling my house and had to step out for a showing. So let me catch my breath here real quick. So obviously Fairfax, we're concerned about this and we're opposing this. The EMS response time from Station 5 that Chief Callahan had on the screens, Station 5 doesn't respond now within 4 minutes. And you provided that data to us in 2018 and 19. So I don't know why we would expect that they could, since they haven't been able to. The next is the Fairfax district contributes 18 to 20 million in property and utility tax annually. We are and have been for almost 70 years the economic backbone engine for Wyandotte County. We'd like to know why you would want to take that protection away from our district that we need. It is our understanding that a 1985 inducement agreement was made between the city of KCK and GM to open their plant, for the GM to bring their plant and build it here in Fairfax. This station was part of the requirements and agreed to. GM gave the land to the city to build the station. We were able to find minutes from the city records from 1985 and 86 that supports this information. Since GM's plant was built, the need for a station in Fairfax has only increased, not decreased, with our continued growth and developments. This Fairfax district receives and delivers through high pressure underground pipelines and fuel tanker trucks nearly 100% of the supply of volatile unleaded diesel and jet fuel for the bi-state region.
You have 1 minute, ma'am. 1 minute.
Okay. Certainty, well, we've got oxygen tanks. We have 10,000 employees. The EMS response time to GM, I already went over that part. Let me skip down. We have 34 railroad crossings in the district, and that blocks other fire trucks and ambulances from getting into our district. The commission adopted the Northeast Master Plan in 2018, which includes keeping the Fairfax Fire Station. Let's see. We only heard about this from Doug Bach and Chief Callahan on April 2nd. We've only had 28 days to try to research this. We haven't been given enough time to research it and have the meetings we need to have, especially while we're under the constraints of COVID.
Your time is up. Thank you.
Next showing up is Judy.
Can you hear me now?
You are unmuted.
Okay, my name is Judy Timmerman. I'm the supply chain director at the GM Fairfax plant. I appreciate this opportunity. First and foremost, while we did see the economics of why the decision was made the way it was, I would start by saying I don't think you can put a price on a person's life, and keep that in mind. The Fairfax district, due to the nature of the businesses and the population of the district, I think we're putting the employees at risk that work in the Fairfax district. But specifically from a General Motors standpoint, I would like to say that there is additional information that we need to see and review with Chief Callahan. Specifically, I have received some information as late as yesterday, and my safety manager has requested that we meet and discuss those numbers, Chief Callahan. So I do need to get some time on your busy schedule to get some more facts about the response times. There was definitely some questions, especially when the data you provided me showed that the Quindaro fire response time for 2018, there was 2 responses and it was 2 minutes and 31 seconds. And we think that there's some issues with that data. Secondly, and Melissa touched on it, back in 1985, we have documentation that there was an agreement to put a fire station on the property where it is now. Due to the COVID, as all the other businesses have experienced, we have been shut down at General Motors since the 3rd week of March. We do have records at our headquarters
You
in
have
Detroit.
1 minute.
We have records, but we are not able to access those records during the COVID. So we need more time because to be honest, we're going to go back and research the legality of the property and the fact that the property was conveyed to the city for the purpose of a fire department. And we think that by removing that fire department, we're putting our employees at risk. Appreciate your time and look forward to having a deeper discussion with the safety manager and Chief Callahan.
Thank you, Judy. We'll do that. Next is Casey B.
This is Brad Casimir. Are you able to hear me?
Yes, Brad.
Okay, I'm the maintenance and engineering leader at the Owens Corning plant in Fairfax. In the past couple of weeks, we've all learned a lot in the Fairfax area about firefighting, fire station staffing, and a lot more, and also NFPA 1710. One of the keys to me, and I think Melissa touched on this too, is looking at the potential for fires and explosions and accidents. And also the importance of that first scene, that first group get into the scene quickly. That was stressed pretty dramatically by Robert Wing, the president of the Kansas State Council of Firefighters. Our Fairfax board listened as the several firefighting experts went over all the reasons that Station 15 should not be closed and why the staffing level should actually be increased. And I was glad to hear the chief mention that at least in some areas, you're asking for approval to get 4 firefighters per pumper instead of 3, where it often is now. But by the end of the presentation, it was really almost unbelievable that we're thinking about closing our Station 15. The one thing I just want to mention, I think last Thanksgiving or the day before Thanksgiving, a lot of people are aware that a semi came through our fence from the heavily traveled road just to the north of our plant and struck our oxygen pipeline and our backup oxygen system. We were pretty blessed that there was not an explosion. We still to this day do not know why, because of the devastation that happened to the system. But that again speaks to the potential between traffic and the type of equipment that is down in the Fairfax area for fires and extreme events. So again, I agree with the others that said, I think we need some more time to get some more information.
1 minute.
Okay. And the reason is, even though this has been going on for years, is, as Melissa said, we've only heard about this since April 2nd, I believe. Thank you.
Thank you, sir. Next up is Mr. Latenzer.
I
believe you're unmuted.
Yeah, thanks for the opportunity to throw a question. I think I concur with the other comments that have just preceded this one. I have a real basic question. I suppose it would go to the chief and the people who can verify these response times, but how were those calculated in the event of a train blocking access at the several points where there are frequent train blockings on the crossing? So the 3 avenues that were described in the presentation showed Quindaro, 7th Street, and 10th Street, any of which can be blocked at any given time. And several of those are blocked for a long period when they are blocked. So I guess my basic question, and it can be information provided later from the chief on how that is calculated. And if there's a call from the station in Quindaro, how do they know which avenue or which of those 3 routes may be blocked or would be open? And then further, once within the district, there can be delays once the Quindaro Station resources are activated and sent down into Fairfax. So that's really my basic question, and we'd appreciate an update on that. It speaks directly to how that's calculated for a response and how response times are calculated in the district.
Okay, thank you. And we will respond to all the questions either at the next setting or back in writing. Next on the list is James Wing.
Hello, can you hear me?
Yes, we can.
My name's John Sima, President, International Association of Firefighters, Local 64. There's been a great deal of new information that we weren't privy to until this presentation this evening. We would like some time to examine and give some consideration to. That being said, we'd like to come back next week with some comments, but defer our time this evening to Melissa Clark from the Fairfax Association. Thank you.
So, Mayor, we have 3 more speakers on the list. I know it's 5 till. Do you want to continue on with those speakers or prepare for the next meeting? You're muted, Mayor.
You know, I think we should proceed on to the next meeting, but you know, we are going to have more time next week. I think with the presentation today, an opportunity for people to, again, to dig into it, provide more information to them, get their responses back and bring that back next week. So in a way, I think this kind of works well. It's not going to be decided tonight. It's not going to be implemented tomorrow. So we need to move on to the next session. We have to change over, I think, the cameras. Well, I don't know if that has to happen now that we're not there, but let's go ahead and move on. And then we have time for one more caller. So let's do one more.
Okay. Next on the list is C. Brown.
Can you hear me now?
You are on now.
Okay. I like to thank the mayor. This is really fantastic. I think this is the way to do things. Thank you, Mayor Alvey, and commissioners as well. I'm just absorbing quite a bit here, and a little more than I inspected. So I'm just going to ask the chief a couple of questions. And I guess one of my questions was, is there a difference in an industrial fire as well as to a residential fire? And I guess the other question is there a deadline for this project to be completed? That's all I really have right now. I can wait till the next time. I know you got other business to take care of. So I just would like to get an answer to those questions if you don't mind. Thank you.
Thank you, Mr. Brown. As we said, we'll try to answer everything in one time. Mayor, I do believe we do have a changeover when we do switch between systems.
So can we call a 5-minute break, potty break?
Yeah, I think we'll probably need till about 7:07 before we can start the Planning Commission meeting.
Very good. Thank you. Thank you all for attending. And again, come back next week.